we'll go ahead and get started on the, what month is this? Our October Board of Health meeting for the El Paso County Public Health. And good morning to everyone. Hope you had a nice drive over. I've heard there's bad traffic out on I-25. And, you know, there's traffic or there's construction on Garden of the Gods coming this direction. So, but that'll be over soon and the roads will be even nicer. So with that, we'll start off with item number 1, which is the roll call. And I am here. Doris Ralston.
Here.
Commissioner Geithner.
Here.
And Commissioner Nelson has texted in. She'll be a few minutes late, but she's on her way. Mayor Dixon.
Present.
Hunter Barnett.
Here.
Dr. Chan.
I'm here.
And Courtney Salt has told us she's going to be online, and I see her there. Good morning, Courtney.
Good morning, I'm here.
Okay, thanks. And Dr. Vu.
I'm here.
All right, so all present or accounted for. The next item is the approval of the agenda, and so I'd ask for a motion and a second to do that.
Mayor Dixon, I'll move approval.
Okay, thank you.
I'll second.
And Commissioner Geithner, thank you. So if all those in favor, please say aye.
Aye.
Any opposed?
Aye.
And with that, our agenda passes unanimously. And item number 3 is Board of Health comments. And we'll start off online. And Courtney, do you have any comments this morning?
I just want to share, I recently spent some time with Kat, going out and seeing the on-site water treatment systems, and that was fascinating. And if any board members haven't, I really encourage you to do that because it's something I know nothing about, and it was a great learning experience, and she is a wealth of knowledge. So that was just a fun thing that I got to do, and I would encourage you all to do it as well.
Okay, well, thank you for that, and I think that's a great idea. We'll just start at the end of the dais over there with Dr. Vu.
No comment, please.
Okay. Go ahead, Anna.
I'll just also say that I was able to also go out with Kat and tour some of those on-site wastewater treatment locations. It was, as Courtney said, it was very informative, and Kat did a really fantastic job in hearing about some of the improvements that are being made in environmental services was incredibly encouraging. I've probably said here before that as a commissioner, that is an area where we tend to get folks calling in, and I know Kat and Deanna are working really hard on improving that, which is really exciting. And I also just wanted to bring up, I'm concerned about some of the news about Colorado and specifically our governor entering into an alternative public health alliance. I don't know if everyone is tracking that. I think it would be interesting to see if we hear anything from CDPHE about that, but essentially it's an alliance of governors. I think there may be 10, 13-ish states at this point. And it's all Democrat governors, and it appears to be an alternative, trying to create an alternative to avoid working with the federal government. So really concerning to me, and I hope that it doesn't impact our ability here to be able to continue working in a nonpartisan fashion. It's a very, just all Democrat states who want to get together and form their own. I think a lot of people are calling a shadow public health agency. So I just wanted to make sure everyone was aware that that has happened in our state, and I think we should watch that closely, and I hope it doesn't affect our funding abilities as well.
Okay, thank you, Commissioner Geithner. Mayor Dixon.
I have had a couple of electeds from Fountain contact me about concerns about the facility down there and potentially losing it. I don't know if anyone here is here from Fountain today, but we may be hearing some more concerns in that regards.
Okay, and they've reached out to me also,
Okay.
and probably other members of the board. Vice President Ralston.
No comment.
And Dr. Chan.
Yes, I have a comment about vaccines, primarily the information about MMRs for Colorado that recently came out. While I certainly support personal choice in vaccines, I don't think that all vaccines are created equal. Certain vaccines have much more of a track record and are known to be one of the most cost-effective public health measures available. But what has concerned me, and I've been following this for about a year, it's both concerning, it's actually alarming, is that certain districts, school districts in El Paso County have MMR vaccine rates on par with Uganda. And I don't know if anybody here has seen significant measles outbreaks, but it can be quite terrifying. In places where I've worked in low resource settings, the death rates were 1%. In Madagascar, I was there when there was an outbreak and 1,000 children died. I think this is entirely preventable. As I said, I think that it is personal choice, but I don't think that it should be at public cost. Obviously, death rates in the United States with measles is much lower, but up to 25% of measles cases require hospitalization. And I think if people are going to make that choice, really they should pay for it. If they're saying that the risk of the disease is lower than the risk of the vaccine, then by all means, take that risk and take on the personal responsibility of the outcome. I'd like to hear a little bit more about what El Paso County is doing in getting our rates above that of developing countries.
Okay, and perhaps in the future we can have that as an agenda item. And thank you for your comments. Okay. With that, we'll go to the next agenda item, which is approval of the minutes. And first, I'd ask for a motion and a second to approve the minutes. What's that?
Are there any changes?
Okay, first I'll ask, are there any updates to the...
Do you want to do them one at a time or both?
We'll do them both unless there's somebody that wants to...
Mayor Dixon, I'll move we approve the minutes for both meetings.
Doris Ralston, second.
Okay, so we have a motion by Mayor Dixon and a second by Vice President Ralston. Is there any discussion of that? And if not, I would ask all those in favor, please say aye.
Aye.
Any opposed?
Okay.
Okay, I don't hear any opposition, so that also passes unanimously. And now we'll move to item number 5, which is public comment for items that are not on the agenda. And Amanda, where there... Okay, is there anyone in the room that just hasn't checked in with Amanda? All right, so no public comment. Very different than city council, Amanda. So we'll move on from there to we won't move on from there. Let me just, I skipped over something that's very important. Yeah. All right. So our next item is going to be a recognition of Dr. Albanese. So with that, I will hand it over to Deanne.
Thank you. And we wanted to take a moment in today's meeting to celebrate our co-medical director, Dr. Bernadette Albanese. Dr. Albanese is going to be retiring, and this is going to be the last board meeting we have with Dr. Albanese. And we certainly appreciate all the work that and support she has provided to our team over the years. And I just wanted to provide a little bit of background. I know some of our newer board members may not have had the opportunity to get to know Dr. Albanese well. So Dr. Albanese, bear with me while I read a little bit about you. Dr. Albanese is a public health expert that we are very fortunate to have here in El Paso County. She holds a master's in public health from Johns Hopkins University and a medical degree from SUNY Upstate Medical University. She completed her pediatric residency at Children's Hospital of Pittsburgh and a pediatric infectious disease fellowship at Brown University. Her career in public health began as a medical epidemiologist for the New Mexico Department of Health, where she worked in infectious disease epidemiology, surveillance, disease control, and applied epi research. Dr. Albanese' journey to Colorado started here at El Paso County Public Health in 2007, bringing her decades of experience in infectious disease, immunization, surveillance, and population health epidemiology. And she has used epi data to improve health of communities, educate the public about disease risks, and inform public health policy. Dr. Albanese's history with us included serving here at El Paso County Public Health from 2007 to 2012, and then her career took her to other opportunities in local public health at Boulder County Public Health, Tri-County Health Department, and most recently with Adams County Public Health as well, helping to establish their local public health agency after the dismantlement of Tri-County Public Health. And then in 2022, we were happy to welcome back Dr. Albanese to El Paso County Public Health when we adopted a co-public health medical director approach for the agency, welcoming both her and Dr. Mayer to our team. Within our agency, Dr. Albanese has primary responsibilities for medical direction for our communicable disease team, as well as our TB team, and providing medical epidemiology support to our data analytics team. In her time with us, she's made a mark on each individual in those teams, providing training, expertise, mentorship, education, and so much support through multiple outbreaks, presentations, dashboards, and so many other activities that the team has taken on. And I think the entire team appreciates Dr. Albanese's approach to mentorship in that she challenges our team, helps us grow professionally, and asks hard questions that help us grow as public health practitioners. Our CD team has worked closely with Dr. Albanese on everything from late night measles rule out, late night calls and weekend rabies investigations. She's worked closely with our data and analytics team, providing expertise on community health assessment and guidance on data governance and policies. And during her time in public health, she has trained and mentored epidemiologists, disease investigation specialists all over the state of Colorado, providing education and helping to build stronger foundation of epidemiology and rationale behind our public health activities to create healthier communities. And one of the things that I've particularly enjoyed in working with Dr. Albanese is her grit through difficult circumstances and finding solutions to local problems. She is a strong voice for local public health agencies in all of our state calls, challenging what we are doing in our communities and advocating for local public health within the system in Colorado. And we will certainly all miss her experience and expertise that she's brought to our team. And I appreciate the poignancy of Dr. Albanese beginning her Colorado public health journey here with us in El Paso County Public Health and bringing it full circle to close out her career with us as well. So thank you, Dr. Albanese.
Well, thank you, Deanne. And Dr. Albanese, I think we'll let you speak first, and then I'll open it up for board members if they would like to have a few comments.
Thank you, Deanne. That was really wonderful. And some of those things I was going to highlight, but I'll be a little briefer than I had originally planned. So don't give me a microphone; it's generally a dangerous thing. Thank you very much. And as Deanne mentioned, my specialty in medicine is pediatric infectious diseases. And I did do clinical medicine for several years, hospital-based, before making the decision to move into public health and dip my toes into that. And then it wasn't become my toes, it became my foot, my leg, and the rest of my body, and I jumped in. Before coming to Colorado, I was a medical epidemiologist at the New Mexico Department of Health. So medical epidemiologist is a fancy term for physician epidemiologist. And that's really where I could take my clinical expertise and expand it into the public health realm in infectious disease epidemiology and disease control and outbreak investigations, Also did research in vaccine preventable diseases and a lot of systems building, and I think that really grounded me for my work here. El Paso County Public Health welcomed me with open arms back in the day as medical director and director of their Disease Prevention and Control Division, and an active member of their leadership division. And I think that was probably one of the most important junctures in my public health career, to just be at the local level, building systems and improving systems and training. As Deanne mentioned, after I left El Paso in 2012, I worked at the medical officer and director of health services at Boulder County. And then when I switched to Tri-County, it was heavy into population health, epidemiology, and communicable disease. So for the last 3 years coming back, serving as co-medical director with Dr. Mayer, I have dedicated my focus to our communicable disease, TB programs, and epidemiology. And so I will say, I so love this work. And in particular, I have found great joy and fulfillment teaching and training our staff. That is a big and a very important part of my career. It was when I was a resident, it was when I was a fellow, it was when I was an attending in the hospital training residents. My hope was to pass on my experience and help staff rise above in their knowledge, become critical thinkers, to be objective and fair, and to perform their work at the highest level. And I have set high expectations for the staff that I work with. As you can tell, I've been around the block a little bit. I know governmental public health. I am a strong advocate for local public health, and that's including and in the context of my state health department experience in New Mexico. I know that we have unique responsibilities to engage with our community to provide the best services we can. And so one thing I wanted to share today, and wanted I'd like for you to hear from me, is that the staff at this agency care about their work in public health. They care about this community. They're in it because they believe their work improves lives. Whether they're epidemiologists, disease investigators, nurses, nutrition experts, food and water inspectors, health planners, whether they're issuing birth certificates, promoting mental health awareness, permitting safe septic systems and pools, educating to prevent injury, or frontline staff addressing questions from the public that people care about. This agency is their career, whether this is where careers begin, where staff learn and grow and flourish professionally, or where a career ends. These are good people. I know that. And I am very, very appreciative of the teams who have had the honor and privilege to work closely with. Especially over the past 3 years. Please celebrate them with me. Please acknowledge their commitment to public health because it's real and it's true. I know their work matters. Please recognize that it does. Thank you, El Paso County Public Health, for enriching my life, both professionally and personally. You have meant a lot to me. I am where I've landed, and my success has very much been influenced by this agency, and I'll remember that forever. Thank you. And I'm a crybaby, so that's how I express my feelings.
So, Dr. Albanese, your love and dedication to this work, is clear to see, even at this very moment. I want to thank you for what you've done in the 5 years I've been on the Board of Health, answering questions, sometimes pointed questions from board members, and I want to thank you for your comments about staff here and support for them. And I'm going to open it up for comments from the board members.
I would like to just say, thank you so much, Dr. Albanese. I know when I've asked for additional information, you've always gone and you research it and you get back to us and you look at the big picture, which I think a lot of times we have tunnel vision, some of us, and you always are concerned about the public health, the big picture of all of that. So I appreciate that very much, and the sacrifices that you've made to be our co-medical director for all these years, and then in the previous time that you spent here as well. So thank you. I wish you well and much happiness and good health.
Anyone else? Any other board members? Commissioner Geithner.
Obviously, I have not had the pleasure of working with you for as long as some of the folks on the board, but in the interactions that we've had, the TB discussion comes to mind. I really do appreciate your thoroughness and patience with answering so many questions. So thank you, and I wish you the very, very best.
Any other board members? Dr. Chan.
Dr. Albanese, I'm sorry that we've had such a short time to work together, but I'll tell you, I was heartbroken when I heard about your retirement. I have appreciated the way that you've presented hard scientific data in a way that's easily understandable to the lay public. For a relatively petite person, you have just outsized shoes to fill. And I, for one, will miss you deeply.
Any other board members? Yeah, Mayor
I just say,
Dixon.
it sounds like you've had a very impressive career, and thank you for your service to El Paso County. It's greatly appreciated.
And in closing, I suspect we're going to take a picture. Is that right? Deanne, we're going to do that? Okay. But before that, just once more, thank you, because it takes good people like you willing to commit to public service in various capacities to make our county, our state, our country what it is. And so let's hope we continue to have people like you willing to come forward. Would you like to share what your next chapter is going to be after this?
You want the honest answer?
Sure. Yeah, we'll take an honest answer. I like those.
I don't know. I don't care. And I'll figure it out later.
All right. So you're gonna enjoy a morning on the porch and examine your options. So that's very good too. Okay. If there are no other board member comments, then I think we should get a photograph with Dr. Albanese.
Thank you from the bottom of my heart.
Thank you.
I can grab the photo. I think this would make a great backdrop if we could have board members in front of the pictures. I'm going to have you front and center. Then if any staff members want to join and be in the photo as well.
Okay, and now we'll turn to finance and budget. Item number 6, And I'll hand it off to Deanne.
Thank you. I'd like to thank the board for your time at the last meeting for our budget work session. I appreciate the input and the time and the guidance that the board has provided. And we will have our routine update, and then Lauren will be leading us through a presentation of our preliminary balanced budget. And before we do that, I would just like to acknowledge as well that we have taken a different approach this year. Typically, our budget team has been part of the county financial services division, and through the guidance of the county's chief financial officer, we have adjusted our approach this year with the in-house budget team, and I think that has made such positive impact on our team to have Lauren here as part of our team and working daily with our programs and our grant managers to help develop this preliminary balanced budget. So we'd just like to start off with that appreciation.
Okay, and good morning, Lauren.
Good morning. So first, we're going to go through our September financial summary, and this follows the presentation we discussed previously. Haven't made any changes to that. So the first three columns are our originally adopted budget, any changes approved by the board, and then the revised budget for 2025. Then moving to the right is our actuals as of September 2025. And what I find most informative is the last three columns on the right for projected total, and projected variance. Something that has changed since our last discussion is our state LPHA funding. We received a notice from the state that that is going to be reduced due to state budget impacts. We received formal notification of that, but not our updated agreements. So we're still waiting to see how that will play out. But so we've reflected that as an estimated downward projection for our state LPHA funding for the year. So far, it's come in as expected, but we're just not sure what the timing of that reduction will be. So just to be conservative, that's been captured as a full reduction for that revenue source. So that's a variance of $248,000 less for that revenue source. Our program-specific grants are expected to be less than budgeted for that revenue source, and that's mainly due to less utilization of our CDC A1 grant, but we are able to use that grant going forward through 2027. Our licenses, fees, and permits revenue is projected to be higher than budgeted by about $580,000, and as discussed previously, that's due to increased fees as well as improvements in processes for fee collection. Our Medicaid fees and insurance is projected to be a little higher than budgeted. Similarly, changes in fees and in improved processes for collection. And then our interest income is projected to be less than budgeted due to a variety of factors. So overall, our projected revenue for the year is expected to be under budget. But in contrast to that, we're expected to be under utilizing our expenditure budget. Our personnel is expected to come in about $400,000 less than budgeted for 2025. Similarly, our operating expenses are projected to be about $700,000 less than budgeted. So tracking with our discussion last time, we're still anticipating using less of our fund balance than budgeted for the year. We had budgeted using $970,000 of our fund balance, but we're anticipating only using about $120,000 of that through the end of 2025. Questions, comments?
I'll start off with one question, and we'll see if there are any others. What's the big driver on the reduction in operating expenses? You know?
Yeah, so there's a couple of factors. A large component of that is we allocated about $300,000 for response and recovery efforts for emergency response, and we have thankfully not needed to utilize a large portion of that. I think it's $20,000 so far for the year, so that's a big driver. And then we have made a lot of process improvements and efficiencies with all kinds of things related to cell phones and internet. Those are contributing factors. And then we also made a strategic effort to reduce travel and training expenses for the year, kind of discretionary expenses.
Okay, yeah, that explains it. Any other questions from board members before we move on? Looks like maybe a question, and then is it a comment, Carrie? Yeah.
I just want to say thank you from that operational savings perspective of looking for those savings and finding that. I think it's really phenomenal, what you've just been able to accomplish in terms of looking for that and reducing that impact to the reserve so that can be utilized for other one-time expenses moving forward, and look forward to just seeing continued process improvements, and you've done a really fantastic job.
Okay, and Commissioner Nelson.
Thank you for making the edits to how this is laid out. For me personally, I'm tracking a lot more easily. But really quick, you said we're going to be using $120,000 of fund balance. Where is that on here?
It's the second to the right column, projected total, and then the bottom row, net impact.
Oh, okay. Okay. And maybe you said this and I missed it, what is it that we're dipping into fund balance for?
So originally, when the budget was developed, there were allocations for fund balance for environmental health staff to cover a timing difference for our fee revenue to catch up for cost recovery. There was also allocation for response and recovery dollars, and then there was allocation for ADA remediation.
Yes, and I believe there was also some funding allocated for support and training that we've been able to utilize the infrastructure grant versus some of the response and recovery dollars and adjust some of those plans as well.
Okay. So what was the number we were anticipating and now it's the 120?
So we budgeted 970.
Oh, wow. That's great, but it's less. Okay, thank you.
And if I
Please.
may say something related to the comment about efficiencies that our staff have found, I would be remiss if I did not offer my gratitude for our operations team. We have undergone several changes within our operations team over the last year, and they have been very diligent and focused over the last several months in reviewing our ongoing expenses, working with our vendors, and bringing more structure and planning to those expenses to a very positive impact for our team. And I'm particularly grateful and appreciative of our operations team and all their efforts in doing that.
Okay, thank you for that, Deanne. And I don't see any other questions at the moment. And so why don't we go ahead and proceed, Lauren?
Okay, so next is our 2026 preliminary balanced budget presentation. And I just want to acknowledge that this is a collaborative effort of the whole team, just here presenting. But first, we'll go through a historical budget review. We'll do a fund balance review, and then we'll discuss our budget development process, and then go over our 2026 preliminary balanced budget. So this is a snapshot of our budget from 2019 through 2026, just to show the large and dramatic and quick increase in our budget during the pandemic. And then that's coming down over time as we return to steady state. But it was almost doubled over a 4-year period, and then is coming down as operations return to normal. We'll discuss this later, but our 2026 preliminary balanced budget is about $26 million. Related to our budget history is a full-time equivalent employee count by year for that same time frame. So 2019 through 2026, you can see we scaled up during those years of increased activities and are coming back down as we return to steady state. For 2025, we started the year with 195 FTE or full-time equivalent employees, and we're currently at 172. And then we project that we'll be entering 2026 with 167. And that's reflected in our budget. So then we'll discuss our fund balance a bit. Our fund balance is our savings. It's a cumulative difference of revenue over expenditures for the year. And so we have a fund balance policy that the board has adopted that we are to maintain between 18 to 21% of our budgeted revenues. And that is well above the recommendation for the governing body, our Government Finance Officers Association recommendation. And we'll look at a little history of that in a minute. But currently, we entered 2025 with a fund balance of $7.3 million. Some of that is not available for us to spend. Some is restricted for Tabor Reserve that is mandated by state law. And then some of it is just in a non-spendable form. But we are well within our percentage thresholds. If we had used all of our fund balance as planned for 2025, the end of the year would bring us to 23%. But as discussed, we don't anticipate using all of those authorized funds. So 26% is where we project we'll be with our fund balance requirement at the end of the year. And this is just a historical snapshot of the same time frame, 2019 through 2026, with our fund balance and our requirement threshold of 21%, so we're well above that. But I just wanted to note here that historically, we've been around $4.5 million in our fund balance prior to the pandemic. So that is a more historical baseline, just of note. So then we'll move into our budget process. And I just want to state that people can ask questions anytime. Please let me know. This is our process and timeline for our budget development, which began back in June with preliminary discussions with interim executive director and the executive team. Then moving August through September, we met with staff and program managers and reviewed revenues and compiled detailed budgets at the program level. We reviewed that with the executive team. And then last month, we had a work session with the board. Going forward, we continue to review ongoing changes with the executive team. We're reviewing our fund reserve request, and today we're presenting the preliminary balanced budget. So this process has included a lot of evaluation of our revenue streams, which have significantly changed, and we'll discuss further evaluation of our personnel needs and analyzing any positions that could be eliminated. analyzing our operating expenditures, as Deanne touched on, trying to improve efficiencies and reduce costs. We analyzed our allowable indirect costs that we're allowed to charge on our grants to cover administrative support to run those grants. And then we analyzed any changes to our grant budgets from year to year. So some process highlights. So we did a lot of analysis of our staffing models and infrastructure to support our core priorities and sustainability. Reviewed our operational processes. We did some intentional staff education and training about the public health budget and our revenue sources and streams so that we had clarity and awareness regarding the budget for staff. We updated language and job descriptions to include notes that all staff positions are subject to grant funding because that's a large majority of our revenue. Some challenges. Grants are about 50% of our revenue annually, and they're restricted and time limited. There are anticipated budget cuts and categorical grant reductions. There's disruptions to historical funding streams. There's uncertainties related to next state fiscal year that are open at this point. And then we're moving to a more sustainable staffing model. And then Public Health South is a challenge, and those operations are included in our 2026 preliminary balanced budget for that facility.
Question.
Yeah, Mayor Dixon.
Do we have like numbers served by each facility?
We do. I don't have that.
Yeah.
Okay.
Yeah, if I think probably we should kind of focus on the budget at this moment, and then
Yeah.
maybe either in a subsequent email or after this, get questions
Yeah,
about
that's
South.
why I brought it up on
Public
this one.
Health
This is
South.
like curious if we had the numbers.
Yeah, and I know there was even some concern that Public Health South had already been pulled out of this proposed budget, and that's not true.
Right.
It's still in here at this
Right.
time.
Okay,
Yeah.
thank you.
Yeah. Go ahead, Lauren.
Some strategies is that we continue to look for new funding sources. We have identified a new grant funding opportunity from the state for chronic disease, and that is anticipated to be about $200,000 in new funding for 2026. We continue to receive incremental funding from our grants. We just were notified of additional funding for our Title 10 contract of $78,000 that we had not anticipated that we would be receiving. We continue to evaluate our organization and structure so that we can work flexibly. And then just kind of a separate or new activity that we're pursuing is a clinical services medical billing roundtable to improve our Medicaid and insurance billing. It's a collaboration of 10 local public health agencies that are sharing information and best strategies on how to contract with insurance companies and bill effectively. So that's exciting.
I have a question on bullet point number 4. I guess it's a two-part question. One is, how do you, and this is probably more for Deanne, how do you identify emergent needs? And the other part of my question is whether it's a push or a pull, whether these identified needs within El Paso County are driving the search for grant opportunities, or whether grant opportunities present themselves and then the strategic plan and work plan is adjusted to reflect the opportunities that are available? Which way does it go?
Thank you. I think the honest answer to that is that it's a mix of both. So we do have a development officer, Carolyn Gary, who works with our team to evaluate funding opportunities. Those funding opportunities include governmental funding from state and federal levels, as well as looking at foundation funding and looking at our eligibility related to that, and pursuing different funding opportunities that come available. So we constantly review opportunities for funding and evaluate that within the context of our agency, what we feel we can reasonably pursue and what we are eligible for, and try to bring forward a balanced approach to our funding opportunities. One of the things that we have discussed is trying to make that a bit more visible to the board so that we can share information in the director's report regarding funding opportunities evaluated and considered for application, so that you can have more insight into that process. But generally, we are trying to focus on broad opportunities, not limiting only to governmental or only to foundational and nonprofit opportunities, but a mixed approach. And then within that, looking at our strategic plan, looking at gaps that we feel that we have and how we can approach that. So I think there will also be more opportunities in the future to have more conversations with the board regarding that.
And then how are you identifying what the emergent needs are that you want to meet?
So for emergent needs, we tend to be thinking about that in terms of public health response and those emerging needs that we have to address within the budget and in a timely manner. So being prepared this year, one of the things that we did is try to incorporate into our budget the response and recovery needs so that we have some scalability to our team and to be able to mobilize things quickly, to look at different opportunities for partnerships and think about how we can be flexible and scalable within our capacity.
Do you have a general breakdown of the proportion of funding opportunities that we have had historically or project going forward that are coming from governmental sources versus private sources?
We would have to spend some time to prepare that in detail. In general, I would say the majority of our historical funding has come from governmental sources. However, we have pursued and received other funding. We have received at different points in time funding from El Primar as well as from Colorado Springs Health Foundation.
Thank you.
Okay, I think we'll throw the ball back over there to you, Lauren. Keep going.
So some highlights for our preliminary balanced budget for 2026. Maybe not highlights, but we have a revenue overview that includes about $2.3 million decrease in our grant revenue for 2026 compared to 2025. That's about a 16% reduction in that revenue source. We do have some new funding opportunities, including a $200,000 chronic disease grant that is included in that decreased grant revenue number. We are anticipating a reduction in our state LPHA dollars, $248,000 mentioned in my September presentation. We are anticipating an increase in our fees, licenses, and permits revenue of about $500K. Our interest revenue is projected to decrease, but it's a very small percent of our overall budget. And then we just wanted to express gratitude to El Paso County Board of Health and the Board of County Commissioners for support, guidance, and direction through this process.
Can I ask you one question on this slide, Lauren? And if it might be Deanne can answer this, just because she's been here a few years. That $509,000 increase in revenue from fees, licenses, and permits, is a lot of that the result of the increases which the board voted on and passed a year, 2 years ago?
Yes. The board implemented and supported an increase in locally controlled fees at the end of 2003 that went into effect, the majority of them, in January of 2024. So that has been a positive impact on our cost recovery for those fees that are controlled locally. And the retail food fees that are set at the state level were increased this year in September, but the majority of that work is front-loaded in the calendar year. So in 2026, we will realize the impact more fully of those increased retail food fees as well.
And I think it's worth pointing out that the increases that the board voted on back then are just to recover cost, and then in some cases to provide a little more expanded service, just more people going out and inspecting the septic systems, things like that. So it's good to see that it's helping. Yep, Commissioner Geithner.
Since I wasn't here for that process, what is the percentage of cost recovery? Is it 100% or?
Yeah. I will just add this before Deanne goes on, it was phased in over a number of years. I don't remember how many. We didn't do the whole thing at once. It was over 3 or 4 or 5 years.
Hi, I'm Kat McGarvey, Environmental Health Division Director, so I can speak a little bit to the environmental health fees. Statutorily, we are able to cost recover 100% in the OWTS, or on-site wastewater treatment system program. Every other program within environmental health, we can cost recover direct costs, but not indirect fully. So the other programs, we're not able to fully cost recover through fees. So we have to balance some of that with agency funding as well. And then the phased-in approach, there was one fee on the on-site program, which related to property sales. That was phased in over 2 years. Our intent is to review these on an every 3-year cycle, so we'll begin that process again next year with the hope of having revised fees in 2027.
And I think Commissioner Geithner's question, I'm not sure if we can answer without looking it up. Did we raise to get back to 100% or not, or did we only get to 90 or whatever?
So in OWTS, our fees were assessed based on the time and activity as well as cost in that program, with the intent of being 100%. The other programs are generally somewhere between 60 to 70%, outside of retail food, which is done by the state. That we are currently at a 40% cost recovery in that program, with the implementation into 2026 from the triennial review over 3 years, with the intent to be between 65 and 70%.
Good. All right, thanks, Kat. And go ahead, Lauren.
I do have one additional question regarding the interest in the fund balance, et cetera. So it looks like the projected interest for this year is approximately 2% of what the fund balance is. I don't know if it's coming entirely from the fund balance or not, but for this year, any kind of treasury note has returned 4%. And it may be a small portion of the budget, but that would mean an extra $144,000, which is at least 1 or 1.5, possibly 2 FTE. What are the allowable investment opportunities for $7.2 million?
That is managed by the treasurer's office. I could try to get some information related to that. I know that there are specific investment options, but I don't have any information about that.
And so to make that clear, public health does not choose how to invest the money, not allowed to. That has to be done by the county, the treasurer's office, and there are strict guidelines on what they can invest the money in. And we don't have that information today, but is there a way we can get that and maybe email it out?
Yes, we'd be happy to follow
Yeah.
up with the treasurer's office for more detail.
Okay. We've looked at the same thing, Dr. Chan, on the city side. And there are just strict guidelines on what it can be invested in, and some of it has to be a certain level of liquidity, so you can't even go out that far. But we can get the answer to it. Okay. Anything else on that one? Okay. Okay, Lauren.
And then our expenditure estimates are mainly related to human capital, which is our personnel, and makes up 76.76% of the budget. Related to that, we have included a planning assumption of up to 3% compensation increase for staff going into 2026. Sorry if this is small, but this is our overview. Oh,
Yeah,
sorry.
Lauren, we have a question for
I
you.
have a question back on the compensation. Is that recurring, or are we doing anything with like end of year bonus or non-recurring compensation benefits?
I'd be happy to speak to that. So for our 26 budget, this is our budgeting assumption for annual increases. And as we follow the county process, so when we come back for the original adopted budget presentation, we anticipate we will have a more detailed estimate of personnel costs as the county moves through the process of assessing what the annual increases will be. But for the purposes of the preliminary balanced budget, this is our planning assumption that follows in alignment with our conversations that we've had with the Financial Services Division.
So will the board at some point have a conversation about if we wanted to do in addition to the recurring, some sort of a supplemental one-time, hey, thanks for all your hard work this year. With having such a high fund balance, and that's one-time money, that is a way, it's really hard to use up fund balance with it being one-time dollars. So it generally, in my mind, is capital improvement, or sometimes, kind of giving that one-time appreciation bonus for the hard work.
Yes, thank you for bringing that up. And typically, we do follow the county's process. So if the county, their calculations for one-time annual awards, we will typically follow that same approach. And we have historically funded that within our budget.
Okay.
But if we utilized fund reserve for that and the board was receptive to that, that could be an opportunity as well to utilize that.
Okay, that was going to be my other question of just understanding. Part of our budget comes from the county, and so when we're doing compensation increases in this department, is that supported through the county increasing our general fund allocation, or is it we're finding it ourselves within our own budget?
It's typically a mix.
Okay.
So historically, yes, the county does support some, but
Okay.
not the entirety, because not the entirety is funded through the county.
Okay.
One thing that we try to do very closely, though, is work very in alignment with the compensation team in El Paso County Human Resources, so that when there are the compensation studies, the classification studies, and other opportunities to adjust compensation, we do strive to align with that county process and stay closely aligned.
Okay, thank you.
Okay, Lauren?
So this is our 2026 preliminary balanced budget. This is a summary of all activities for public health for 2026. Our revenue allocation from the county is $7.2 million. Our reduced funding from the state for our LPHA allocation is $1.5 million. Our anticipated revenues from program-specific grants is $12 million. Revenues from licenses, fees, and permits is $4.8 million. Revenue from interest income is projected to be about $150,000. Revenue from miscellaneous and contributions is mainly comprised of our City of Fountain lease at South, and that's about $20,000 a year. So total revenue for 2026 is budgeted to be $25.7 million. Our personnel expenditures are budgeted at $20 million. Operating, $5.8 million, and then capital is $255,000. And we'll talk through some of the capital in later slides. Overall total expenditures, $26 million, with a preliminary planned use of fund balance of $300,000. And we'll talk through what comprises that in subsequent slides. Any questions?
Mayor Dixon.
Do we periodically get breakdowns like between administrative costs versus direct support costs? Do we periodically get those costs?
Historically, we haven't presented that level of information since I've been here, but can prepare any level of detail.
I thought I would, if the board would so desire to have that information. That's something that I've kind of been keyed in on over the years.
And I don't know if we want to do it now, but I'd want to just discuss exactly what, maybe we can talk
Right.
offline and then send something out to the other board members, see if we agree that's would be helpful to have that
Correct.
information and how often.
Yeah.
Okay.
Yeah, no problem.
Okay. So we will double back on that one.
Okay.
And did you
Thank
have
you.
anything? Yeah, okay. All right, Lauren.
Okay, so these are our fund balance use requests that comprise that $300,000 use of fund balance amount presented. So there's $15,600 for ADA compliance. That includes third-party remediation software and website support. There's $40,000 for an update to our audio-visual system that's used in this room and other rooms. It's at the end of its useful life. And then there's a request for environmental health vehicle purchase for $215,000 for 5 trucks. And then I will ask Kat to please come up and discuss that request because the board had some questions about that.
Thank you, Lauren. So we have talked about this in a previous board meeting and introduced the idea of purchasing fleet vehicles for our OWTS team. OWTS is the on-site wastewater treatment system team. The board had asked us to prepare some additional information, and so I'm happy to bring that back to you all now. Can we move to the next? Thank you. In your packets, there is a lot of information in there. I'm going to attempt to summarize this really quickly just for purposes of this presentation. But essentially, you asked us to make sure that we are in alignment with other agencies and other divisions throughout the county, as well as provide a cost analysis and how that would work within our budget and for our program. So our environmental health OWTS team has a high reliance, and our environmental health team as a whole has a high reliance on their personal vehicles to complete their day-to-day tasks. Our environmental health specialists spend about 70 to 80% of their time in the field completing routine work. Our OWTS team specifically does most of their work in rural, unmaintained areas of the county that create some substantial safety concerns as well as compound the wear and tear on the vehicles that our regular mileage reimbursement doesn't always fully cover. So our OWTS team specifically averages about 6,000 miles annually in their personal vehicles for the purposes of completing inspections. They also put about 1,700 miles each on the current county fleet when they do use those, because there are some areas of our county that many of my staff cannot take their personal vehicles given how the area is maintained. For instance, Midway, if any of you have ever been down to the Midway area, there's several areas that are hard to access back there just based on the terrain that is there. So rural terrain, variable access, and our equipment needs necessitate an evaluation for department-owned vehicles. So through review and discussion with other county departments, including County Fleet, Pikes Peak Regional Building, and their fleet managers, as well as stormwater and code enforcement who routinely have access to official vehicles for their work, we have determined that we are one of the only, if not the only, division that does not provide these vehicles directly to our staff. For instance, Pikes Peak Regional Building inspectors do have access to vehicles which they do take home and are able to use to do their work. Same with stormwater and code enforcement based on the conversations that I've been able to have. This also, go back one more, sorry. There are, for us and what we do, when we're inspecting wastewater treatment systems, there is a risk that we are going to run into surfacing sewage on the ground, right? Some of these systems are repairs, which means that they are actively failing. And as they're being repaired, that's going to require systems which are in active use still to have pipes cut, different. They're going to excavate into the ground where the existing system has already been in place for a period of time, which increases our staff's risk to harmful pathogens, and the tools that they're currently utilizing, such as levels, tape measures, their shoes that they're walking to these sites in, can become exposed to these, and then they track that stuff back into their own personal vehicles, in the spaces where they keep their children, their pets, where they use to transport groceries. So the model comparison, next slide, in this, using our personal vehicles limits our ability for proper equipment. Having proper equipment can really increase our efficiency as well as limit the number of trips we have to take to these sites. So for instance, if it rains overnight or it snows overnight, we have an expectation that our industry does go out and clean these sites off, but they don't always get there, or they have them cleaned off and the snow continues, right? So if we show up and it's covered, right now we can't inspect those, and we have to ask them to come back out and uncover that. Our return trip fee currently is $338. If we had things such as brooms, shovels, 4-foot levels, probes, that makes it easier for us to sweep off or clear areas reasonably that we can do to avoid coming back to facilities or sites, which means that we also gain time in our staff stay to be able to respond more readily to community members' needs. The reimbursement rate for personal vehicles is 70 cents per mile, and we are reimbursed at the federal rate. There are times where that doesn't cover the gas that we put in our cars just to get to these sites, let alone the wear and tear and the number, because of the rural terrain, we end up having to replace suspensions in cars, tires more frequently than most people do on a regular routine basis. And the employees are responsible for ownership, maintenance, and accidental insurance on their cars. So, if something were to happen while they were inspecting a site or they were to get into a wreck, the employees are ultimately responsible for being able to replace their car essentially the next day to continue doing their work. And that can be a real hardship for some of our staff. Right now, our mileage reimbursement comes a month behind, so our staff are actively spending more of their money that they're getting paid just to complete the work that they're needing to do. Whereas if we had department-owned vehicles, we're able to have proper equipment and be able to complete those inspections in a much more safe manner. The annual operating cost for department-owned vehicles is 35 cents per mile based on what county fleet has provided to us. And that includes the gas, the maintenance of those vehicles, and so that is all-encompassing. It also allows us to increase our professional image through visibility and accountability, meaning that we can have marked vehicles. Out east, it's It's very challenging. When you live out east in the rural setting, most of the people who do that know whose car belongs to who. And if there are cars out there that are out of place, it can create some safety concerns for our staff as well. A lot of times our staff also park their cars on the road and walk into properties just to avoid that, which some of those driveways can be a mile plus in length, so that also extends our time as well. Where if we had county-owned vehicles, you know, they should know that we are coming to access their property and they see a county-owned vehicle, that creates some ease for the community as well. And it allows the agency and the county to have direct control over those vehicle safety and maintenance standards to ensure our staff remain safe while they are on the roads. And so the final slide I have for you is a vehicle purchase cost in a table for ease of viewing. We are asking for $43,000 is the current estimate that we've received to purchase trucks, and that's $43,000 per truck. They have a salvage value of about $8,000 in an 8 to 10 year useful lifespan. At the variable operating cost per mile, 35 cents for county maintained or county department owned vehicles versus the IRS mileage reimbursement rate of 70. So if you're looking at each of our OWTS staff putting an annual mileage rate of about 7,600 miles per year at a total of 38,000 miles over 5 staff members, the cost to maintain those vehicles on an annual basis, or the cost that we're incurring on an annual basis based on those numbers, shows that we currently pay in mileage reimbursement about $26,000, just under $27,000 per year to those 5 staff members, whereas county-owned vehicles would annually cost us about $13,000 per year. So we would have roughly about a $13,000 savings annually after the initial capital investment. Questions?
Yes, Hunter.
Thank you, and thank you for the detail. I apologize for not asking these questions last time. But I do have a few questions. So the first one, are these net new to add to the fleet, or are you replacing, say, the 3 vehicles that are at 8 years when you say that the new fleet vehicle life cycle policy is that they will be replaced between 8 and 10 years? So what I'm really getting at is, if these are net new, are you going to come back next year and say, we need to replace these other 3?
Sure. So we have the intent, they would be net new. So these would be 5 vehicles in addition to our current fleet. However, we do have the intent to move a minimum of 1 of the Durangos to auction. The county policy is to send those to auction. That cannot happen until next year. They don't like to send them at the back half of the year because of the financial impacts that can have to budget and things like that. So, however, the other vehicles do have relatively low mileage and are still in good condition. So the intent would be to keep the others at this point for regular use for the rest of the agency.
Great. Second question, have you looked at leasing? Have you done the analysis on leasing versus buying?
That we have not, however, thanks to our operations. Kara, do you have any information on that?
Hey, Kara Price-Stock, I'm the division, or the business operations division manager. So I don't have any information on leasing vehicles. We follow the county fleet policy, as well as looking at state purchase of vehicles. Currently, I am not aware of any leasing opportunities. Happy to look into that and see if that is a possibility. It was not offered as something that's done within the county fleet currently.
Do we? So I think you have the general support of the board. I think. We'll see. But for me, I would want that to be one of the last remaining stones uncovered, at least for me, on this analysis. Because I think you could be surprised on how the numbers change, leasing versus outright buying. And that kind of leads to my third question, which is, where do you plan to buy these vehicles?
So county fleet currently purchases a lot of the vehicles. I've spoken with them. They're able to look across the county prices and pull them in. And they also gave us this purchase price for the specific size and type of truck that we're looking at, so that there are easy reach out. We will have to do a quote analysis, so put out a request for quotes to get the best purchase price, but County Fleet does handle that, so we'll probably go through them.
I ask because I hope the first stop is a local dealer within El Paso County, and if we can't get a good price there, then at least Colorado with a last resort of out of state.
Sure, and when we put out our contracts person put together some quotes for us. Those were from local dealerships.
Okay, great.
So they pull those numbers. He has access to that. And then he will help us work with County Fleet in order to purchase vehicles through their system.
Okay.
And then that also allows us, County Fleet, to track the vehicles as well as have all that information. It keeps it all nice in-house so that we can continue to track maintenance and safety on those vehicles with them.
Great. Okay, thanks.
Okay, thanks, Hunter. And I do believe we might have some follow-on questions to that. So why don't we go with Commissioner Geithner? Is yours related to what Hunter's talking about? Yeah.
It is, and so I wanted to kind of maybe provide some additional information too on the leasing. So I think because, in particular, we have a lot of public works vehicles and kind of be similar. It's not like your standard vehicle you're going to be able to turn in after it's been utilized to that capacity. So I think that is a big portion of why we don't. But we are always looking for ways to save money. And so I'm sure that the questions would be welcome. And I'm sure that, the county would happily provide those. But I do think it's because of that. As I know, regional building is in the same boat. Their inspectors have trucks, and we've had the same. I'm the chair of regional building, and we've had a lot of the same conversations around finding those efficiencies. But same thing, kind of with the type of work that it is. It's not your typical lease. And then just remembering too that they're very specific. Kind of we were talking about those interest rates and the kind of policies. They're very specific procurement policies that the government has to follow. So that's guiding through a lot of that. But if there's, we are always looking to find efficiencies. And so if there are questions about leasing, I'd be happy to make sure that we can help look into those as well.
And Mayor Dixon.
Yeah, I noticed that you're looking at as an accessory locking roll-top bed covers. If these are open bed pickups, you may also want to consider bed liners because the materials just aren't what they used to be in the beds.
Mm-hmm. Yeah, those are good ideas. See, when you start talking about vehicles, everybody's got some ideas. Go ahead, Dr. Vu.
Just a couple of things. So the current vehicles that we have now, how much are they being used, and can our current staff use those vehicles now? And number two, I'm not clear on what the ask is of the board. Is this decision, should this decision be made at the board level, or should it be made at the director level?
Well, I think what's going to be asked is for us to, eventually, this is just an initial budget, but to approve a budget, and this would be in the budget. So, and board members, my understanding was at the last meeting, asked for some more granular detail on these vehicles. So we're getting what we asked for last time.
Isn't this a
Go
board
ahead,
request for fund balance?
I just wanted to offer that clarification. Part of the reason for this discussion to come to the board is that we would make the original purchase for this capital investment via fund reserve. And to utilize the fund reserve in our 2026 budget, that is why this request is being built into our preliminary balance budget. And then when we come back in December for board approval, the fund reserve requests are built into that budget that you would be approving.
Great, thank you. Then the question really comes back to the current vehicles that we have. Can we use them now?
Sure, so I can answer some of that. Our usage on them is relatively low, and I can let Kara has more information on that than I do. However, with the current vehicles, 2 Dodge Durangos and a Jeep Cherokee, I believe, those vehicles are enclosed. they're SUVs, which present the same safety risks. However, that then translates to more of our agency. We also are in very muddy situations, construction zones that tracks a lot of stuff into the cars and tends to wear them down over time as well, and prohibits use by other members of the agency for, out-of-county travel or to do transport things for clinics or different community events as well.
So, and Kat, so one way to say what you're saying there is just pickup trucks where all the equipment can go in the back in a compartment, what do we call it, the bed. People aren't going to be back in there, so if there's contamination, it stays isolated from the people.
Which also means that we can take that to a car wash and hose out the bed and the equipment and tools and help eliminate some of that too.
Okay. And Commissioner Geithner?
That was one of the points I was going to make, is that it's much easier to clean the bed of a truck than it is the inside that's carpeted and all those things. I want to say thank you for this. This is tremendous information. I am really impressed with what you guys came back with and really showing this. I think it's fantastic that it's actually going to save money. To me, this is a no-brainer, wonderful use of one-time fund balance that is going to improve the agency. And again, also save money. I think it would have been worthwhile, even if it was a little more expensive, but it's nice to see that, as a matter of fact, it's a win-win on both of those. Having gone out and been at those sites and seeing that surfacing stuff, I think, it's also a great way, in my opinion. I hope that it would really boost employee morale and just really help them understand that we want to make sure that they have what they need to do their jobs. And like I said, to me, I just really want to point out that I think this is just a exemplary use of fund balance, and that being able to do this is truly an improvement. I just think it's really impressive that you guys came back with all this data. I'm glad the county could be helpful, but this is exactly the kind of data that I think is really helpful in decision making. So really great job.
So just for clarification, we currently have 5 vehicles, and 3 of them are at 8 years, and you're just going to take one to auction, is that correct? So if we buy 5 new ones, then we'll have 9 vehicles.
That would be, yes, that is the intent.
And then in subsequent years, you'll auction the others eventually. I mean, I'm just curious on how much they're going to be used.
Sure. So we are in operations currently looking at utilization of these vehicles. It is our intent to auction off one of the Durangos currently, and then reevaluate where we are with utilization of the vehicles after the 5 new vehicles are purchased, to decide whether or not we want to auction off more of that. Not with an intent to replace, but an intent to make sure that we have the vehicles available to the agency that are needed. But not so many that we don't need all of them and they're not being utilized efficiently. Sure. Mm-hmm.
Kat, can you remind us how many inspectors we have out, at a time, that would be using the vehicles?
For OWTS specifically, there are 7 team members, including the division manager, who at any given time can be in the field.
You said 7, right?
7.
7. Yeah.
Generally, 5 are regularly in the field.
Okay. Okay, so that's potentially 7 vehicles, and then you always, it could be 1 down or whatever with maintenance. Other questions?
Yeah,
Dr.
I
Chan.
have some questions about these numbers, because obviously the decision is based on these numbers, and some of it may be projections, so I want to make sure it's as accurate as possible. So when you're saying that that currently people are often using their private vehicles and driving about 6,000 miles, that's 6,000 miles per private vehicle. Is that for 7 individuals or 5 individuals?
Based on these numbers, it's for 5, for comparison to the 5 vehicles we're requesting.
And so on a daily basis, you're thinking that there's, every day there are 5 people who are in the field? And I noticed that for the fleet vehicles, that some of the use was for OWTS, but some of the use is for other things. So what proportion of this mileage are you anticipating for OWTS? Because that's your primary concern, is the contamination from OWTS, particularly partial inspections or full inspections, right?
Right.
Okay.
So the annual mileage per truck on this chart here, at the 7,600 miles, that's on average what the OWTS individual will drive over the course of a year.
Okay. So, okay, so you're saying that you're anticipating about 38,000 miles for OWTS alone?
Correct.
Okay, and
Yeah.
that doesn't include the other functions that you might be in the field for?
Correct.
Okay. And do you know, on average, how many miles you would drive for each OWTS visit or inspection?
I don't have an individual number of miles per inspection, just because when people go out, they generally do multiple inspections a day. And so I can tell you the longest time one way to any site from this building is 1 hour and 20 minutes.
Okay.
So I can tell you time-wise, I don't have specific mileage. So we go as far as Rush and Rama and all the way out to the Simla border. The Simla County line out there. So, and all the way up to Palmer Lake. We go through Cascade, Green Mountain Falls, and sometimes back into Rampart Range, and then we go down as far as Midway, down on the south end.
Okay, so there were, well, I guess, let me see, for 2025, you're looking at about 441 OWTS inspections. Is that right?
So right now, as of today, or as of the end of September, we have received 438 permit applications.
Okay.
And that's about a 30% increase over last year. So we've actually gone up this year. The inspection numbers vary because the construction and the length of time can vary between when permit is issued and the inspections called in.
Okay.
So on average right now, I believe that's the number. I don't recall that off the top of my head.
Okay, so that's up until September.
Uh-huh.
The 2025 total is up to September is 441, including partial and full
Correct.
inspections.
Yeah.
Okay, and so you would project that maybe there would be 500 or 600 by the end of the year, because there's, people aren't digging that much in December because the ground
You'd be
is frozen.
surprised. You'd actually be surprised. Really our slow months are January and February.
Okay, so about 3,800 miles, 500, that's 76 miles per trip.
Give or take, yeah.
Per inspection, even though they kind of task chain it. Okay. And then the mileage reimbursement that you're looking at, the total annual cost of $26,000, is that what is being reimbursed now to
Yes.
the employees? Okay.
Yes, ma'am.
Okay. And then the projected 7,600 miles as opposed to the 6,000 miles, is there a reason why you're projecting?
That include, because some of our OWTS staff now will come and get some of the current fleet vehicles depending on the areas that they go into. So they put about 1,700 miles on the current fleet vehicles and then 6,000 on their personal vehicles over the course of a year. So over the course of the year, they're putting on about 7,600 miles. 6,000 of that is generally on their personal vehicle.
Oh, so 25% of the OWTS inspections are actually done in the fleet vehicles
The
right
current
now?
ones, yeah.
I gotcha, okay.
Yeah. So there are some areas like Turkey Creek down off Highway 115.
Yeah.
We don't actually let any staff take their personal vehicles back there just because it's a challenging area to get in and out of. And a lot of our staff, for example, one of my staff members on OWTS drives a Honda Fit currently that doesn't get into many places, so.
Okay.
But it does get outstanding gas mileage.
It does. There is that.
My wife has one of those. It parks great and it's in tight parking. If anyone wants to buy one from us. Any other questions, Dr. Chan, on that?
I don't think I have any additional
Okay.
questions. Thank you.
Any other vehicle, any questions on this topic? I'm not sure if you were finished with the presentation
Yeah.
or not on the vehicles yet.
Yeah.
Okay. What do you need from us at this moment, Deanne? Any kind of indication or just that was information for us? I think you've gotten a sense of support, but what else?
There is no additional action that I need at this time. Wanted to have this conversation so that when we move to the OAV presentation in December, board members feel prepared to support the request or have additional questions answered prior to that, such as the lease question.
Oh, I do have one more question. I'm so sorry. On our previous discussion, Kat had indicated that there would be a time savings because people don't have to come from home and then pick up the fleet vehicle and then go to the site. So these vehicles would actually be kept at the person's home. So how does that work if you have 5 trucks for OWTS inspections, but there are 7 people available for the inspections?
Sure. So our managers and one lead is actually an in-office staff. So they would have more regular access to the vehicles that are kept here. The 5 vehicles we're requesting are for the field-specific staff that are required to be in the field more often than not.
Okay, thanks.
And Kat, is the process going to be they pick it up Monday morning, drop it off Friday evening, or how does that go?
The intent would be that they do, once we have them, that they are keeping them at their home so that that's ready to go at any time for them. So once they have them.
So they keep it the entire month, just turned
Yeah.
in for maintenance or something like that?
And so when we have scheduled maintenance, because one member of our OWTS team is always on what we call an office week, so that they can provide or process their paperwork. So we would try to schedule those on their office week when that's
Okay.
not available. So that would also mean the truck would be available to anybody who would have to help in those instances.
Okay, thanks for that extra information. If no other questions, then, one more.
Mine's a finance question. I'm fully on board with this purchase. I just want to understand is the timing, because we're talking about budget for next year, but this is fund balance. So I assume this is going to come out of fund balance in the 2025 realm, like that this is going to happen before the end of this financial year.
So at this point, we are planning it for early 2026
Oh,
purchase
okay.
out of the 2026 budget.
Okay. And then I guess just a follow-up to that would be, I'm looking, I don't know if you need to go back to it, but I'm looking at slide 15. I just keep going back because I'm trying to understand the numbers and getting a sense of like where we're actually going to land, the amount of money in our fund balance after these requests of the audiovisual, these trucks, and then what that percent ends up being. Because I think maybe it would be helpful if you did go back to slide 15. And you don't have.
Was it the September summary? I'm sorry.
Well, it's not in.
I don't have the numbers. I apologize.
Oh, yeah, keep going. I'll tell you.
Okay.
Yes, this one, yes. So there, that last bullet says, if I'm interpreting this correctly, because we're only going to end up using 120,000 out of previously planned fund balance expenses, we're at 26%. So now with these additional requests, where is that putting us at a percentage and total dollar amount? Like it says the total fund balance at the beginning of 2025 is 7.28, but yeah, so if you could maybe next time just come back with
Some math.
Yeah, some math would be
Yes.
great. I don't want to think that hard right now and calculate it and make some assumptions that maybe I'm not interpreting correctly, because if it isn't part of 2025 but 2026, but it would just help me to know, like I agree completely with Commissioner Geithner that this is an excellent use of fund balance on purchasing trucks that help support this work. But so then where does it land us? And I don't know if it makes sense to put a line item on this one.
Sure.
That like is just, fund balance, and then whatever you think, but that would help me to understand a little bit more where we're actually landing. Thank you.
Thank you. In terms of this vehicle purchase, I would like to have some clarification on the current vehicles and the possible purchase of 5 trucks. If there are 5 people in the field for OWTS and a total of 7 staff, why would we need 9 vehicles, especially if 2 additional of those vehicles are already 8 years old? Why wouldn't you sell 3 of those vehicles to help fund the purchase of some of these new vehicles?
I can speak to that a bit. So the current fleet vehicles that we have are generally utilized across the agency. So when we have a mobile clinic, when we have a community event, those are the vehicles we're utilizing to move our supplies and equipment to those sites. Those Durangos may be 8 years old, but most of them are fairly low mileage and still in good working condition. So when we look at the average lifespan of 8 to 10 years for a fleet vehicle, we are moving closer to the 10 years for those because of the relative low mileage for them. We are not planning to turn them all in because the other staff who have field work, but not their same routine field work, do utilize those vehicles, and we still want them available for community events, or when our teams go to trainings in Denver, they will often carpool in a fleet vehicle, and those SUVs add capacity for us to be able to move multiple team members at a time. So we would anticipate maintaining some flexible fleet vehicles for the broader staff, while these 5 vehicles are specific to the OWTS team.
So are you anticipating that on a daily basis, you would have 8 to 9 vehicles in the field or in use?
We are anticipating that for OWTS, these 5 vehicles would be in the field daily, essentially. The other vehicles are on a more rotating schedule for team members to utilize for community events. That doesn't mean that they are in the field on a daily basis. It is more driven by what activities are occurring.
So do you think that you would have more than 2 vehicles in use in addition to the 5 that are in the field at all times?
It would be difficult to say at this, and Kara is looking at our current utilization. Kara, if you have more specifics on current utilization on a daily basis, I
don't mean on a daily basis. I mean, do you anticipate, obviously the 5 vehicles are going to be out, the 5 trucks would be out with OWTS pretty much daily. And then you would have 4 additional vehicles. So are you anticipating that you're going to need those 4 additional vehicles at some time? Or are you anticipating that at most you might need 2 vehicles at some time?
Right, and that's part of what we are assessing in terms of with selling, potentially putting 1 to auction, then looking at the utilization of the remaining, how frequently we're utilizing them. We also utilize them in other elements of environmental health when we are training staff. Rather than duplicating mileage to have team members meet at a facility, they will utilize those other vehicles to carpool during training for like our retail food team that is in the field on a daily basis.
Okay, I think my question is, I'm not making it clear, is are you anticipating more than the use of 2 vehicles in addition to the 5 at any particular time?
Yes.
Okay.
And before Kara speaks, I'll just say I would prefer that public health keep the 4 Durangos, which are in good condition and have low mileage, versus getting rid of 2 of them immediately and then coming back to us in a year and saying, you know what, we actually need we need an additional vehicle, and then we have to buy a new vehicle. So it can be assessed next year. They can look, and if there's we're not using them, I would trust that the executive director would come back and say, we've got an extra, well, I don't think you can just get rid of it at that time. But
have
let's hear
anything
from the
to
real
add.
expert. Oh,
No,
well,
I don't
are
have
you sure?
anything to add. Deanne covered that perfectly. That's exactly what I was going to say. So we'll keep looking at it, and we'll make decisions as we're able to look at the data for usage.
As a guy who drives a 2001 Chevy Suburban, older vehicles with that are doing well, not bad to hang on to. But I appreciate your fleshing it out for us. And are there any other questions before we let Lauren continue? Okay, Lauren.
So this slide is just a comparison of the 2026 preliminary balanced budget to the 2025 budget, and just differences in our revenue and expenditures. I do think this would be a good slide to include the fund balance information on, so you can see the impact. But we budgeted $970 for 2025. We're preliminarily budgeting $300K for 2026 for those items we just discussed. And then this is just a visual representation of the budget. You can see that almost 50% of our revenue comes from program-specific grants, and that was impacted by decreases from 2025 to 2026. About 18% comes from licenses, fees, and permits. About 28% comes from county support. About 6% comes from our state LPHA funding, and then 1% from our interest income, for a total of $25.7 million for revenue for 2026. Then this is a graphical representation of our expenditures by category. As mentioned previously, personnel is 76.76% of our expenditure budget for 2026. The remainder for operating and a small percentage for capital. And that is a $26 million expenditure budget. Some remaining items in this process. Today is the preliminary balanced budget presentation. On November 4th, we're going to meet with the Board of County Commissioners to present preliminary information. And then on December 10th, we'll come back to this board for our original adopted budget for you all to adopt via resolution and appropriate. And then the last slide is just acknowledgement and thanks to staff for excellence in budget preparation and financial reporting for last several years. These are just some achievements that we've been recognized for our annual comprehensive financial report, our budget presentation, and our popular annual financial report. And that is it.
Okay, are there any final questions for Lauren on that proposed 26 budget? Kind of asked them as we've gone along.
Thank you,
Vice
Lauren, for the
President.
detail.
Thank
Much
you.
appreciated.
That was a nice question. Anything else? All right, good job, Lauren. And,
Executive session.
yeah, okay. So I think that wraps up everything and before going into executive session. So I will hand it off to Lori and let her guide us into executive session.
Thank you. I'll read the items into the record, and then we would need a motion, a second, and a vote to go into executive session. So we do have two executive session items today. The first is an executive session pursuant to CRS 246402-4A for the purpose of discussing the potential sale of public health property at 6436 South US Highway 8587 in Fountain. The second is an executive session pursuant to CRS 246402-4F for the purpose of discussing personnel impacts of the federal government shutdown.
Okay, thank you, Lori. And with that, I would ask for a motion and a second to go into closed executive session.
Move we go into executive session for the reasons stated on the record.
I'll second.
Okay, thank you to Commissioner Geithner and Mayor Dixon. If there's no discussion, then I would ask all those in favor, please say aye.
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 Any
Aye.
opposed? Thank you, Courtney. And I don't hear any opposed, so that passed unanimously. And with that, we'll have to give the team a few minutes to do that. And when we come back out of closed executive session, I would imagine we'll be in closed executive for 30 to 60 minutes, you think? The only thing we'll do after that is adjourn, unless I'm forgetting something. And so if you're watching online, there really won't be much after this except an adjournment. And with that, I'd say let's take a 10-minute break while the room is prepared for closed exec. Thanks.